Welcome to EHI TV, eHealth Insider's essential news on video. This week we're taking a look at EHI Primary Care's survey of Primary Care Trust and Strategic Health Authority staff. I'm Shanna Crispin, and with me I have Fiona Barr, editor of EHI Primary Care, to tell us about the results of the survey. First of all, Fiona, can you tell me why the survey was conducted and who took part?
Okay, well, this was the second survey that we've done of PCT and SHA staff. We conducted the first one when the NHS reforms were first announced last summer, and that showed a lot of uncertainty among NHS staff, not surprisingly, about what the reforms would mean for them, because Andrew Lansley had said that he planned to scrap PCTs as part of the reorganisation. So we wanted to go back this time and find out how staff were feeling now, what happened to their jobs, and also the impact of the need to make £20 billion of efficiency savings over the next 4 years. We ran the survey for nearly 4 weeks, and we had about 100 respondents, most of whom worked for PCT IT departments or health informatics services, and about 40% of them were department heads or senior managers.
Okay, so what did the survey tell us about those people working in PCTs and SHAs?
Okay, well, it found basically that things are very uncertain. A lot of people are not sure what's going to happen to their jobs. More than 80% either said they didn't know what was going to happen to their job, or they thought they were going to lose their job by 2013. There were a lot of stories of people having to reapply for their job, maybe more than once. Some people who'd been unsuccessful in doing that. Others who reported that lots of people had left and that they were carrying an increasing workload, but still didn't know what was going to happen to their job. So it was pretty gloomy, basically. But there were a few people who were more positive and said that they'd moved into an informatics service and that they were already starting to work with GP commissioning consortia. So it wasn't all doom and gloom.
Okay. So the survey obviously had a look at budgetary pressures being placed on those departments. What did it tell us there?
Not surprisingly, every person said that they were under pressure to save money. Nearly 70% said that they expected their IT budget to be cut by at least 10% this year. And nearly 40% said they expected it to be cut by more than 20%. A lot of IT departments said efficiency savings were being made across the board in all departments, and IT wasn't exempt from that. They were looking for savings on IT infrastructure overheads. Some said support services, IT support services to GPs were being cut. Again, there was some more positive comments with people saying IT had been identified as an enabler to put through the new projects for the new NHS, and that their departments were looking to invest in IT to save overall. Okay.
You've been involved in this for a little while. Were you surprised by the results? What do you think it tells us about the state of play?
Well, the key finding really was lack of clarity about the future, which is not surprising. That obviously has been exacerbated by the current listening exercise that the Department of Health are conducting on the reforms. People are not sure, what's going to happen to their job, as I've said, or how the NHS the structures are going to finally work out. I think that's probably particularly the case for people working in IT departments and doing IT functions, where we don't know how IT is going to be managed in the new NHS. So I think, some people in some areas are already working with consortia and seem to have got that more sorted, but others are not sure whether consortia are going to want their services in the future, and where or how they will be placed.
Bit of an uncertain time.
Yes, so I think people are looking forward to the information strategy coming out and more detail on the outcome of the listening exercise. We'll certainly be covering that, and also we hope to run another survey in 6 months' time to find out what's happening to staff then.
Okay, thank you, Fiona.
Thank you.
For more coverage on the EHI Primary Care Survey, please visit www.ehi.co.uk.